So hand expressing is a really useful skill to have alongside breastfeeding. And it can be used to collect some colostrum that we've just talked about in your pregnancy, which is perfectly safe to do so. So if you were interested in hand expressing some colostrum, you can do this beforehand. We usually recommend that you don't start until after 37 weeks, but you can start hand expressing colostrum and storing that in your freezer, which you can bring into hospital with you once you're coming into hospital to either have your baby. Just bring that in with you. In particular, it's very useful if you're having a baby that you know may be what we call higher risk of low blood sugars, particularly if you yourself are diabetic. So that might be that you have pre-existing diabetes, or that you have become diabetic in your pregnancy, and you know, preparing for your baby who we know is at more risk of having hypoglycemia, it is a great thing to do. So antenatal hand expressing is something that we recommend for you, to bring in that colostrum so that we can assist your baby in that first few hours after birth. If they don't feed, we've got colostrum ready for them, or we can use colostrum to top up their feeds just to protect them from reducing their blood glucose levels. It can also be really useful if you've got a baby who's having a few problems latching. So some babies are born and they're a little bit sleepy and a little bit slow to get started. Hand expressing is really useful because you can get some colostrum to give them in the meantime. It's really good to tempt them to breastfeed. So just being able to express a little bit of colostrum onto your breast so they can smell and taste colostrum to entice them into breastfeeding. It can be really useful if your breasts are quite full or tender, or if you feel like you may be getting any blocked ducts or swollen tissue within your breast. You can use hand expressing to relieve that. So let's have a little look at a nice simple hand expressing technique that you can learn. You can start, like we've mentioned previously, you can start this technique in late pregnancy in your third trimester after 37 weeks, or it's something that you can practice just in readiness for your baby's arrival. What we recommend is that you have a nice clean, possibly a sterilised container to collect your milk in. We will provide you if you want one of these cups, and we can talk about how you get hold of these at the end of the class. And also we can provide you with some of these little syringes here, which collect colostrum quite nicely because it's so small volume. These are just 1 ml, so you don't have any wastage in the syringe. So first of all, before you start expressing, obviously clean your hands, wash your hands nicely, make sure that they're nice and clean, use some antibacterial gel on them as well. And we're going to talk about hand expressing and also some of the physiology of it really. There's 2 hormones that are really useful when you are breastfeeding. They're essential. We have the milk making hormone, which is called prolactin, and the milk releasing hormone, which is called oxytocin. So one of the things that you can do to try and help increase the release of these hormones while you're hand expressing is a little bit of breast massage and nipple stimulation. Okay, so what we recommend is to begin with that you just give your breasts some massage. Okay, now it helps if your baby is nearby as well, because if you have your baby nearby, then you release oxytocin. If you're still pregnant, then something to think about your baby, maybe a baby grow, or something, an ultrasound scan picture, something that gets your hormones going. If you're separated from your baby after the birth, then a piece of clothing or a photograph, something that will help those hormones flow. So lots of firm circular massage strokes around the breast, or you can do some kneading of the breast. Just gently, obviously don't be too firm, it needs to feel nice as well. So just round the breast tissue here, and all the way around. So remembering you have to do every part of the breast. Some people quite like the sort of finger tapping on the breast, but another one that's quite useful is to just do nice firm strokes down the breast and just kind of engage the nipple a little bit here, because at the same time as this you're also doing some nipple stimulation, and this is really good. So you're getting the oxytocin, and then with the nipple stimulation you're getting the prolactin. Okay, so also a little bit of nipple rolling just as you do that. So nice firm strokes and then just onto the nipple. And sometimes really most of the time you won't even be aware that you're releasing these hormones. They'll just be happening in the background. So for this, really you look at it just a couple of minutes before you start, just to kind of loosen this all up a little bit. So like I say, lots of variety of massage strokes there that you could try. So have a little go, see what you prefer. When you're ready, when you've done your massage and you've been doing that for a couple of minutes, what I recommend is that you make a C shape with your finger and thumb. Okay, so these are going to be the fingers that you're going to use on your breast for expressing. So taking your fingers back, so if we say this is the base of the nipple here, we want you to take your fingers back about 2 to 3 centimeters back from the base of the nipple. This is really about finding the right spot for you. Okay, so again, we all come in different shapes and sizes. This pigmented part of your breast here is called the areola. So you have your nipple and then your areola here. Okay, and so again, we have different size areolas. In pregnancy, it often darkens as well. So you might have found that your areola has gone darker in pregnancy, and that's just a normal change that you would expect. So taking your fingers about 2 to 3 centimeters back in that C shape, just a nice steady compress. So pinching your fingers towards each other and release, and compress and release. Now, it might be that in this spot just here, you do feel a slight change in texture of the tissue underneath. If you don't worry, that's absolutely fine. If after a few moments of compressing and releasing, absolutely nothing happens, then you can reposition your fingers slightly. You could go slightly further back. It might be that for you, you need to go a little bit further back, or it might be that you need to come a little bit further forward. But either way, you're free to move your fingers in position just a touch until you find that right spot. When you find that spot, the milk will come. Okay, so with nice steady compressions and releases of your breast here, you will start to notice on the end of the breast here, there is some little globules of colostrum. So it'll come out in little dewdrops onto the end of the nipple. It can be a little bit tricky when you're trying to manage collecting it as well. So obviously make sure you're nice and comfortable with your compress and release here. And when it starts to come, just kind of catch that drop on the end into the cup and keep doing that while ever it's flowing. The milk will continue to come in. It is quite slow. It does take a moment or two before that milk starts to move. So remembering, don't slide your fingers towards the end of the nipple. Try not to drag the breast forward. It won't be effective. You will not get breast milk, but also it will probably hurt. It will be really uncomfortable. So just to keep that C shape in the same spot, compress and release and compress and release. Okay, keep working that spot. Now, when the colostrum is starting to slow down or it's completely stopped coming from that spot, what you can do is you can move your fingers now, keeping that C shape, into a new spot. Now, it might be that you have to reposition and go back from the nipple 2 to 3 centimeters and start again. Okay, so this is compress and release, compress and release, and keep working that same spot again. Same process, wait for that milk to flow. When it does, just catch it with the cup on the end and keep going, and keep catching those drips on the end and keep going. When the milk starts to dry up from that spot, so slow down or stop completely, you can move your hands again to a new spot. So again, you might have to go back 2 to 3 centimeters to find your right place, and compress and release, and compress and release, and compress and release. Okay, so keep trying that in the same spot. When you feel like you've worked the whole way round one breast, you can move over to the other breast and you can start the whole process again. So again, you would begin with breast massage and nipple stimulation on that breast for a few minutes, and then starting with your C shape and until you've worked all the way round. So it's really just a few minutes of expressing, really. You don't have to do this for a long time. You'll probably find that after a few minutes of working in one spot, it does start to slow down or stop anyway. If you're expressing after your baby's been born, and this is the early days and we're talking about colostrum, it is going to be slower to come. If you are beyond 3 days and your milk supply is starting to increase, after a few moments of compressing and releasing in one spot, it may squirt. But squirting is not normal when you're producing colostrum only. It's more something that you would see once your milk supply is established. But hand expressing is useful, like we've mentioned, for lots of good reasons. If you do decide to do this antenatally, so in that latter part of your pregnancy, those last couple of weeks, what we can do is provide you with a liquid gold kit. It's something that we do provide here at Kingsmill for mothers that are having their babies here, and the infant feeding team can cooperate with you to arrange whether you pick this up at one of your appointments or whether you drive by the front of the hospital and we'll run it out to you. And sometimes when they're out on visits in the community, if they're nearby, they could always post it through your door. So please do contact us. I'll give you our contact details towards the end of this antenatal class. Inside the liquid gold kit, what you would have, we normally give you at least 5 syringes, which come with a little cap on the end here. So these are all 1 ml syringes. We would give you a label per syringe as well. So any milk that comes into hospital must have your name, the date that you expressed it on. Okay, so those 2 identifiers have to be on there. And once your baby's born, we would also put the date your baby was born as well, and maybe potentially what room or bay that you are staying in the hospital. But we can also provide you with one of these cups. So we give you a small kit. We can always top up that kit if you need to, if expressing goes well. Storage wise, what we would say is if you're expressing in the antenatal period, you might want to break that up into small expressing sessions throughout the day. So you might do an expression in the morning and collect some milk in here. It might be that you get, a couple of ml at that time, and then you might decide to express again in the evening. So you think, okay, I'll use the same syringe. So you express, you collect it into the same syringe, and you're now kind of almost at a full syringe. If you're not planning on expressing again later that day, what we would recommend is that this syringe of colostrum now needs to go straight in the freezer. Okay, so you would label it up. Any milk that you're doing in between, storing in between expressions, must go in the fridge to keep cold. Okay, when you bring your milk into your colostrum into hospital, it must all be labelled, as I've mentioned, but it defrosts once you take this out of the freezer. This defrosts really quickly. A collection of syringes, let's say you had 4 or 5 syringes, you took them out of the freezer. If you don't keep them cool while you're transporting them, they could be fully defrosted after half an hour. And if you're thinking about driving into hospital, parking up, getting into hospital, you need to keep transport these with freezer packs. So what we recommend is you buy an insulated bag, maybe a lunchbox, something that's got that insulation lining, pop an ice pack in with your colostrum syringes and transport them with that ice pack so that they don't defrost on the way in. And obviously once you get to hospital, just hand them over to the staff once you get there, let them know that that's your frozen colostrum, and we will put that straight into our storage freezer for you. We do recommend before you go home, if you have any unused colostrum syringes, that you take them with you, because if we heat them in our freezer and you're no longer a patient, we would have to discard of those or ask you to come back and get them. So don't waste them, take them with you. It's precious stuff and you can give it to your baby anytime, even though it's colostrum. If you have any questions about this and you're not sure, obviously please do get in touch with us. We're more than happy to keep helping. So we'll just do a recap on the technique there. So 2 or 3 minutes of massage to begin with, really thinking about your hormone production here. So oxytocin, feeling relaxed, also known as the love hormone, helps your milk flow more easily. It's the milk mover hormone. Also nipple stimulation gets the prolactin released. That's your milk producing hormone. So both of these are essential when you're breastfeeding. Make your C shape with your finger and thumb and place it about 2 to 3 centimetres back from your nipple and gently compress and release in a nice steady rhythm. Do remember, avoid sliding your fingers forward down the breast tissue. It won't be useful and it will likely make you feel quite sore. When the flow stops or slows down, move your finger and thumb around, think about U-shape. That's quite a nice way to remember it. And just do the same thing again. So a nice steady rhythm, compress and release so that you're working a new section of the breast. Now remember, colostrum moves very slowly, so it can take a little while. Don't expect to see something immediately, but keep going, okay? Expressing is still stimulating even when you don't have production. So it gets those hormones released. It tells your body to make milk. So it's useful in lots of ways.